Welcome, dear viewers, in our format, Natural Medicine. Today, again with Dr. Volker Schmedl. Welcome, dear Volker, it's good to have you back. I think I'm a permanent guest now. Yep, thank God. I'm also very, very grateful that I've been able to work with such qualified doctors as yourself. You're one of those people who just gets to do shows to give the viewer the real deal. Great gifts, not commercial, but real gifts. That has my utmost respect. Thanks for taking the time. So, dear Volker, I'd like to talk to you about the widespread disease, namely the so-called depression diseases. You see more and more today that it's spilling over. Also maybe from your 35 years of doctor experience. In short, why is it that it becomes more and more today? Or does it just seem like it's more and more of a widespread disease? One reason is certainly the definition. Back in the day, there was an old definition in the psychiatric guidelines that if someone has a really bad mood for 3 months, only then it was classified as depression. Today, the criteria has changed. If someone is heartbroken for 2 weeks, it's already depression. Yeah, hello, 2 weeks of heartbreak, that's considered normal. It would be abnormal if it wasn't. Is it reported as being sick then? That's already considered in need of treatment. And then, of course, I can prescribe antidepressants. Depression, bad moods. There's always been a bad mood. There are always those ones. They come, they go. You're only supposed to treat it if it's really a disease. If it's strong enough and if it lasts long enough. So every little bad mood doesn't have to be depression and certainly should not be treated with medication. That's certainly one reason. But I also believe that our way of life today, with more pressure, more stress, more demands that others and also ourselves put on us, which can never be enough, that actually increases the frequency as well. Nutrient levels seem to have deteriorated. Less sun, less exercise, less fresh air, all these are also reasons that predispose us to fall more easily into depression. I use the word antidepressants up front. I just thought about what I once watched on American TV. I used to watch the commercials. It was advertised really big there. You want to be happy? If you want to be fresh, take this and that antidepressant and you'll be fine. Well, I didn't know if I was going to be able to buy it without a doctor's note. If that is prescription free. Does it do any good at all? Antidepressants like that? I wouldn't start with them at all. Yes, trying to buy happiness with that, because I always say that that's borrowed. It's like any drug. We can buy happiness with any drug, whether it's alcohol or cocaine or opiates. We can buy any mood we want. But then we always have to pay a price, which is that the pendulum will swing back to the other side. This is unavoidable. And happiness is something you can't buy with pills, but quite the opposite. We now even know that these antidepressants are addictive. I still learnt it in college. Sedatives, tranquilizers, they're very addictive. But antidepressants are not addictive. And we have been misled for a long time. We've been told at that time, okay, someone's on antidepressants, then he is reasonably stable. We're going to leave out the medication and then he goes back to depression. Aha, the underlying disease still persists and he just has to keep taking it. We know today that it's not true at all, but these are withdrawal symptoms from the antidepressant. How do we know that? How can we tell the difference? Antidepressants are used today not only for depression, but also for pain disorders and also for certain bladder disorders. And they found that if these people take antidepressants for a long time, and then they let it go, then they go into depression, even though they weren't depressed before. That's the proof. Aha, it's not the underlying disease. It wasn't there in the first place. It's withdrawal symptoms. So just some antidepressant. Careful, careful, careful. They should really only be taken by people who have a severe depression that we can't handle any other way or that may even be suicidal. So you sedate them a little bit with a tranquilizing antidepressant to bring them out of the crisis. But then, as soon as possible, reduce or discontinue. So be careful with the antidepressants. And if you can somehow treat it with natural medicine, do it. Now, I've finally seen and heard it from a doctor. Because I feel like today it's all being handed out so fast, these antidepressants, just for 2 or 3 months. But you say there's also side effects, next to the addiction or next to the dependence on it. Massive side effects. You can also see it in the package insert. The most common side effect of antidepressants is obesity. Quite a few get overweight, many even quite seriously overweight. Doesn't contribute to the mood at all, and libido disorders. And not 10%, not 20%, in the range of 30 to 70%. Only men or women as well, both libido disorders. They're both dead in that way. Yeah, and that's fatal too, of course. I'm getting depressed. If this is an area of my life that gives me a little bit of joy and structure, and that will also be cut off, then obviously that's not good at all. Cardiac arrhythmias as well. Quite often up to the deadly cardiac arrhythmia. And the supplemental packing list doesn't end there. There's dry saliva for so long you can hardly eat properly. The food no longer tastes good when the mouth is totally dry and so on. So it's a long list. It's very, very common. So I think we can finish and we can put behind us, but we do have people suffering from depression, lacking in energy, perhaps at risk of burnout, or really sad, no more sparkle in their eyes. Is there a naturopathic way that you can take with these patients? There are many ways, of course. You have to see if there's any kind of lack that got me into this. One example is the thyroid gland. If I have hypothyroidism, then a typical side effect is listlessness and dullness. And it can very easily be mistaken with depression. I remember when I was still in a holistic clinic in Germany, which also has a psychosomatic department. Then, after the 12-week stay in the psychosomatic clinic, a patient was sent to me. I should go and see if I might find something, and she had a massive hypothyroidism, and I just gave her the thyroid hormones. She called me from home and said, yes, after 4 weeks, everything had gone. 12 weeks of therapy had been completely wasted. She just had hypothyroidism. It's rare now that a sickness is so definite and can be led back to this one cause, but it does happen. So the thyroid gland should always be looked at, and please don't rely on the doctor saying, yes, your thyroid value is normal. The TSH value should be around 1 to 2. The normal value goes up to 4, and 4 is already an underactive thyroid. 1 to 2 must be the TSH value. Other things are iron. Iron is very important. We need it for our energy too, and an iron deficiency can be mistaken for depression as well. So there we already have 2 very important points that are very easy to treat. And then all you have to do is look at what's left of the depression. For me, vitamin D is still very important. We've talked about it several times. Not only important for the bone, not only for the immune system, important also for the mood, especially among the people who are having those winter blues. Winter? Winter blues. Meaning? So, a lot of people report that from November, December, when the dark season comes, they don't feel so good. They have less drive. The mood's getting worse. They want to hide away. Then you should consider vitamin D deficiency. Maybe it's just the vitamin D. And if I fill up the reserves, the mood's already getting better. So now you're talking about the physical lack, which leads to depression. Can that also be psychological, emotional things that really wear down the human being? Of course, when I have problems that I don't cope well with at work, with a partner, conditions of lack, that's totally normal. But also grief, for example. I lost someone who was very close to me. Then I can be sad. I used to be into the Third World movement, and there were cases described from African countries. If someone had died there, the so-called wailing women were crying their eyes out for 3 days. There was yelling, screaming. We Europeans can hardly listen to this. Yes, that is suffering. You have to suppress it. And there are drugs for it. No, we've been crying for 3 days, screaming like we couldn't stand it. And then there was the funeral service and eating, and there was drinking, and we laughed again. So you really got into this grief. But then it was okay again. And what do we do about ourselves, our society, our way of life? No, grief isn't allowed. You must be strong now. And if you can't do it at all, take a drug for it. It'll help you. No, we're allowed to be sad. You're allowed to do that. And then we'll get over it. And it can sometimes even be good to get right into it and let the tears run free. And at some point you've cried your heart out and then it's gone. And then you can come back to life. So that's where we need to get our social attitude to change somehow. And if we're going to support it with natural things like a good vitamin D supply or even a good supply of omega-3 fatty acids, we also know that the omega-3 fatty acids have an antidepressant effect. Tell me more about that. I've never heard that before. Yeah, you've probably heard about the serotonin. Yeah, that's the precursor to our happiness hormones. Our happiness hormone. That's what it's called. And many of the antidepressants work through the serotonin balance. Oh, unfortunately, that's when they force the corresponding effects. But it's not naturally regulated. If I take omega-3s in high enough doses, then my body can produce serotonin much more easily. There's probably one reason why omega-3 has an antidepressant effect. Another reason is the cannabinoids. We know that in our body, in our nervous system, there are cannabis receptors. That's why weed, cannabis, has a psychotropic effect on us. That's why we have these effects, because we have the appropriate receptors for them. This is what we're designed for by nature, as an appetite regulator, as a mood regulator, and so on. And then they found out, there was just a very interesting study the other day, people who were in a severe depression were given a supplement with EPA. EPA is a fatty acid found in marine oils, which has an anti-inflammatory effect. A second group was given EPA. And the third group was given only DHA. And then there was a measured substance that is called EPEA, so not EPA but EPEA. Please don't ask me what that means. I've forgotten the name, it's so complicated. But it's just one of those endocannabinoids. And there you've discovered in the EPA and the EPA DHA group, the value increased very strongly. In the DHA group, alone just a little bit. And there, you discovered the EPA group and the DHA group, after 12 weeks in a large percentage, I can't remember the exact number, 30 or 50%, got over the depression. The DHA group alone, not quite as many. And there you have statistically correlated the connection between the increase in EPA-EA and remission, meaning the ability to get over the depression. You could see that the higher EPEA score had a higher chance of getting out of the depression. Wow. That would mean we should take much more EPA in such times. Yeah, that's right. So taking in fish oil, which is predominantly EPA, most fish oils have that naturally. The algae oil has more DHA than EPA, so it would be more beneficial in the depression. I'd rather take a fish oil than an algae oil. And krill oil is also more efficient in this context. Krill oil is similar to fish in this context, both in terms of quantity as well as the composition. I still advise against krill oil, not because it's bad, but because for the same amount of EPA and DHA, it costs 10 to 20 times as much. So a month therapy of krill oil with a sufficient good dose, it costs 500 francs a month. A reasonable dose with a fish oil, you're only looking at 30 to 50 francs. You can afford that. 500 francs, that's not necessary. Everybody always says, yes, but this works better, it's better absorbed. I also know studies that say, no, it's absorbed just as well. So fish oil, please, not krill oil. I've heard that the astaxanthin is still in the fish oil, and that's why it's still so valuable. Yeah, that's right. It's very valuable because it strengthens the placebo effect, but the great red colour, it's a powerful thing. But the substance itself, it has an anti-inflammatory and an antioxidant effect. Even if someone really wants it, I'd always advise him, get yourself a good fish oil and get yourself a good isolated astaxanthin supplement. You can do that, you know, taking astaxanthin in addition. And then it's still much, much cheaper than completely overpriced krill oil. Then the subject is off the table. Many thanks for that too. Okay, so then we basically return to the people that tend to get depression, or that see their wife or husband is in a depression, to always check the thyroid gland and check your iron levels. Perhaps we already have the course here. D3 supplementation, also for a certain level. You always said between 100 and 150 milligrams. I'm glad you brought up the dosage. I'm always a big fan of measurement and the right level. There's even evidence suggesting to increase vitamin D dosage in depression. So I'm not going for 100 to 150, I'm going for 130, 140, 50, 70. So I want to be at the upper level. I want to be around 150. That seems to be more efficient. So again, be particularly well equipped with vitamin D. So there you take like 10,000, 20,000 units to get up to that level. Yes, you can do this as well. Okay, I'm going to take 10,000 units for 10 to 20 days, and then I'll stick with a maintenance dose of maybe 5,000 units, but then please always measure again after 3 months. Is that enough? There are people who need 5,000, 6,000, 8,000, or if I'm a lightweight, I might be good with 3,000. Measuring and staying with the optimal doses. Is there a combination between the D3 and omega-3s that the combination is so powerful? There are no studies on that. However, we may assume these combination and synergistic effects exist. I would always optimize those together. That's how I'm always on the right side, but I'm not aware of any studies about this topic. But there are studies, enough studies on this omega-3 effect, about that EPA, like you said. I mean, if this is really helping, there's also a study on the correlation omega-3 EPA in relation to the natural antidepressants. Well, there's no opposing study, but a combination study. They took people who were also in the severe depression and who were given a regular antidepressant, citalopram. And that's when they split them up into two groups. One group had additional omega-3 and the other received a placebo. And then you could see the group with the omega-3 got out of the depression much faster. Well, both were regressing, but the omega-3 group was already regressing after 4 weeks, whereas the other group was only regressing. And on the depression scale, a score of 10 indicates 10 is the border between not depressive and depressed, and after 8 weeks, half of the patients were already under. So the average was 10 in the omega group, and the citalopram only group was still at a depression score of 17. That's much higher. Citalopram. This is the conventional medicine antidepressant now. That's right, yeah. Well, they both don't get in each other's way at all, but if I add omega-3 to the antidepressant, I'll be able to get out of the depression a lot faster, which means you can potentially stop taking it much sooner too. Question: can I perhaps also give omega-3 alone? There's also a very nice investigation. They used to examine people who were on a certain antidepressant and hadn't responded. That was venlafaxine. And some have responded to it, so they've been expelled from the study. They only took the ones who didn't respond. Then they gave them a second antidepressant, paroxetine. And the ones who responded were expelled too. And then they only kept the ones in the study that have not responded on very effective antidepressants at all, so the therapy failures. And they said, okay, well, they won't respond to any antidepressant. What are we supposed to do with them now? We're giving them fish oil now. Then they gave a very high dose. They've been given 3 grams of EPA-DHA, which is a pretty good dose. And after 4 weeks, the ones with a depression score of 30 is the limit between moderate and severe depression, Those have lowered their score of 30 in average to 11 in only 4 weeks. And under 10, you're not depressed at all. So the study says even the ones who don't respond to antidepressants still respond to omega-3s. And of course, if the depression is not so severe, I should be thinking, do I even have to take an antidepressant? Omega-3 then you might as well think about it. I'm going to give him some omega-3s. And vitamin D and turmeric. We know turmeric also has anti-inflammatory effects, and turmeric works for depressed people too. Maybe I'll throw in some turmeric, a good curcumin supplement, because we know that depression is not only, but also an inflammatory disease. Depression is an inflammation, and everything which is anti-inflammatory is also antidepressant. I see. And there's even an evolutionary sense that inflammation leads to depression. Why? Imagine our ancestors 20,000 years ago. Someone was attacked by the saber-toothed tiger and got a wound from that. Does it make sense to go hunting the next day? No, it's dangerous. No, exactly. It's possible that if he would go hunting, he's going to die or he's going to get the wound infected or something. So it's better with the wound, with this inflammation, that he's depressed now and lies down in his cage for a few days. So an inflammation that produces a depression saves our lives in acute inflammation. That's how we learned in evolution. The problem is, it still works that way today. Any inflammation promotes depression. Rheumatics are more depressed than non-rheumatics. And it's not because they're thinking all the time, I have this terrible disease, and not because it hurts all the time either. Only because of the pain, but also because of the inflammation. And generally, our society has become a much more inflammatory society today. We eat food that causes inflammation than our food from 100 years ago. And that may be part of the reason we have a depression diet today. So it's a pro-depression diet, unlike 100 years ago. I've also read that the ratio of 3 to 6 omega used to be like 1 to 1, and now it's like 1 to 20, right? Exactly. We're assuming that we had a 1 to 1 ratio in the Stone Age. Still, in the agricultural time of 200 years ago, before the Industrial Revolution, we're probably looking at ratios of 3 to 1, 2 to 1. And today, you said it right. The average today has a ratio of 10 to 1. But people who really eat a lot of meat and sausage and animal things, and especially little fish, like once a week or even much less, they often have a ratio from 20 to 1, 30 to 1, 40 to 1. And we, of course, are more prone to neurological diseases, inflammatory diseases, mental illness. It has to do with this. This all gives more reason to take anti-inflammatory with omega-3. That's right. You know what else kept coming up in the conversation? It should be discussed about this. We're always leaving the placebo group out, although this placebo group is also interesting. And that's what I think. I've always heard from you, 20%? Respond to placebo? It's not quite like that. It always depends on the disease. Yes, there are diseases where we suspect a placebo effect of 10% from medication. And for other diseases, we suspect 50 to 70%. I don't believe it. Exciting. So it's important to believe in your own medication. And I'll also say that if someone is taking cortisone, an antibiotic or an antidepressant, then he should believe in this drug and he should have faith because it'll work better. And if I'm using naturopathic medicine, then I should do it with a clear conscience and with the faith that this medicine will get me well. Placebo effects should be encouraged. It's a good thing we have placebo effects. We want to have real effects, but we can amplify them enormously. And exactly, that is still not really integrated. Having this awareness that we can participate in healing processes through our consciousness. And with those big percentages, it's really gigantic. Yeah, so another very valuable special show with you. Thank you very much, dear Volker. To sum it up, measure iron levels, measure thyroid, supplement D3 and omega-3, and after that I think there's a good chance of getting out of a depression. Also, stay very, very critical in the area of antidepressants, If you already take it, don't just quit, but perhaps supplement with omega-3, D3, and see if you can slowly lower the dose. Did I summarize that correctly? Yeah. To recap, I just watched a recommendation from American psychiatrists. American Psychiatrists Society says people that are at risk for mental illness should take 1 gram of EPA-DHA. And if you already have a mental illness, you should take 1 to 9 grams. So 9 grams is a lot. I've never given this to anyone before. I'd always say 2 grams to 4 grams. Those are my doses. But that's what the American psychiatric guidelines say. Patients with mental illness and psychiatric disorders should take these doses. It's just that I don't know many psychiatrists here who have implemented that so far. There is much good to be added to that. Is the omega-3 research in America simply more advanced than ours? Americans are generally more tuned to nutrients. So in Europe, I've always had the impression that when the doctors come from the universities, the right drugs have been developed expensively. 100 million development costs, so it must be good for something. And the vitamin D, which costs almost nothing, or some weird fish oil or zinc or selenium, those ones should have such effects as our expensive medicines. They just can't imagine it. I think it's a mental problem that you just can't imagine it. But the studies say no, that's just as effective and it complements the other things very, very well. Thank you so much, dear Volker. Dear viewers, I don't want to add anything more to that. I wish you all the best, good health, and thank you for watching. Goodbye to you all.